In an effort to provide students with the best learning tools, the College of Nursing Simulation program is taking on the task of reusing supplies to help conserve costs. These costs will be better spent investing in new high-technology nursing simulation supplies and equipment with which skills and nursing care can be taught. Recycling also lowers student lab fees. Each time you participate in a lab requiring the use of supplies, there will be specific bins for you to discard kit parts or miscellaneous supplies. Each bin will be labeled with the appropriate item name, and it will be your responsibility to place the items in their corresponding bins. 4 students from each lab time will be assigned the title of Lab Leader to ensure that all supplies are recycled correctly in each bin, and to assist classmates with questions to ensure an efficient cleanup process. For larger kit or supply items, there will be a large green bin equipped to handle a higher volume of recycled supplies. For labs where liquid, such as sterile water, is utilized, students will need to discard any excess liquid into the sinks at the front and back of the lab to help keep the remainder of the kit contents free of excessive moisture. There are some items that will always be thrown into garbage containers, such as used gloves and needle wrappers. The lab never recycles needles, and needle wrappers can always be thrown into the closest garbage can. Needles should always be placed into the red sharps container when used, never into recycle bins. Red sharps containers are placed on the walls in between bed spaces and on the medication carts in each section. Broken glass, such as ampules and lancets, should also be placed into nearby red sharps containers. Syringes and syringe packages can be recycled. Please place both the syringe and wrapper into appropriately labeled bins. Please follow all written guidelines and instructions at each station, as these ensure that enough supplies are set out for all students and gives clear cleanup and recycling instructions. If you have any questions regarding where you should place certain items, please ask any simulation staff for assistance. Here is an example of how to properly recycle supplies. In the simulation lab, you will be practicing various skills that will require the use of kits such as Foley kits, wound care kits, suction kits, tracheostomy kits, and more. Please use caution when opening these kits and other supplies so that the packages are not damaged beyond repair. When opening kits, please grab the corner edge and gently pull back the label to expose kit contents. All of these recovered supplies will be put back together and repackaged to use in future skills labs. This is an example of how not to recycle supplies. Forcefully pulling or tugging on packaging will damage kits and make them much more difficult to restore. We hope that you will make it a priority to contribute to the Recover, Restore, Reuse program, as it will benefit you and future nursing students to come.